Coming up on Outlook, from repealing Obamacare to taxes to the budget to the upcoming presidential race, we go one-on-one with U.S. Senator Mitch McConnell. Next on Outlook. Hello and welcome to Outlook. I'm Barbara Deeb. We are rekindling the art of conversation, one story at a time. And the story today centers around U.S. Senator Mitch McConnell, who we are always delighted to have in the studio. Thanks for joining us.
Glad to be here, Barb.
We've got lots to talk about, but let's go ahead and get started with the fact that you are in the area talking about the repeal of Obamacare, in more particular, health care in general. Mm-hmm. You spoke at a hospital nearby and another in an area town. Mm-hmm. What were you telling those people?
Well, you know, the federal government had plenty of health care before Obamacare. It had Medicare, the health program for the poor, and Medicare, the program for the elderly. In a desire to make 30 or 40 million uninsured Americans insured, we delivered, in my view, crippling blows to both Medicare and Medicaid. And so today I had my 31st, what could best be described as hospital town hall meetings. In fact, my colleague, your own Rand Paul, joined me at the one in Bowling Green to talk about the impact of all of this on those who actually provide health care, the doctors, the nurses, the administrators, people who are interacting with patients directly. I don't think it's an overstatement to say it's a devastating blow, because in order to pay for the insurance for all these new people who will now be insured, Obamacare takes $716 billion away from hospitals, hospice, home health care, nursing homes, and the like, and also raises taxes on medical device manufacturers and others. In other words, finances the whole thing out of the programs that are currently in existence for the poor and for the elderly. And it can't possibly work. Whether it'll be here forever, I think, will be determined by the outcome of the election. Because if I'm the majority leader instead of Senator Reid, a repeal of Obamacare will be job one, and if Mitt Romney's president instead of Barack Obama, it will be his view as well. Otherwise, we'll be dealing with it for years to come, and it's completely unworkable, and it's going to be a real blow to the American healthcare system.
You're saying completely unworkable.
Yeah, completely.
So there's nothing in Obama's plan that
Oh, there are a couple of items out of a 2,700-page bill that I think make sense. The insurance companies were already, for example, allowing 26-year-olds to stay on their parents' policies. It's a minor part of a very large bill. The states were already developing high-risk pools to deal with the problem of pre-existing condition. Those are things that, you know, can and should be addressed. It didn't take a 2,700-page takeover of all of American healthcare to do that. And so this can't work. And if we are stuck with it, we'll be revisiting it for years to come.
But there's got to be a better way. The
yeah,
Republican
what we should have
plan.
done, instead of taking a meat axe to the American healthcare system, we should have pulled out a scalpel. Excuse me, pulled out a scalpel and worked on the core of the problem, which is the affordability for those who are uninsured. The best way to have done it would have been to tear down the 50 separate firewalls that prevent health insurance from being sold nationally and develop a nationwide competitive health insurance market, pitting all of these companies against each other in order to drive down costs, rather than having the government basically do nothing to reform the cost side and, in effect, take over everybody's health care.
You know, that's 2,700 pages. Some of this has been implemented thus far. So, you know, if indeed Romney becomes president and you make this job one, so you got to start from scratch? You got to get the big eraser? How are you going to
Well, we really ought to start from scratch. And, you know, we had challenges already with Medicare and Medicaid that need to be fixed before we added all this additional level of complexity on top of it. And we really ought to have a do-over. If the American people give us a chance to start over, then let's try other ways of driving down costs, things like medical malpractice changes, things like interstate health insurance competition that I was just describing, to see if we can drive down the cost. Because of the 40 million or so who are uninsured, they're in two groups. About half of them are young and healthy and think they're going to live forever.
Sure.
The other half have an affordability problem. They just don't have the money. So it's a cost issue.
Isn't it always about the dollars and
Yeah,
cents? Sure.
but let's, use the forces of the market to drive the costs down as a way to make it more possible for more people to be insured, rather than doing nothing to drive down costs and having the government take it all over. In fact, I just think we did the wrong thing, and we significantly damaged Medicare and Medicaid, which already had significant problems before we did this, by in effect raiding Medicare to help pay for it, and by expanding the eligibility for Medicaid, so it will now cover, in the case of Kentucky, 400,000 additional people. And all those people are going to be descending on the emergency rooms all across the state. The healthcare providers are wringing their hands. How can we handle all this additional? Yeah. So that's why I say it can't work. It may stand politically, but it can't work. And so we'll be revisiting this for years to come, trying to figure out how to fix it.
But you say trying to figure out how to fix it, so that's very optimistic in that there could be a fix. I mean,
Well,
an issue of this magnitude,
I
can it be fixed?
I don't know that you can fix this 2,700-page monstrosity. But people are going to be coming back at us, asking us to fix it. As I said, I've had 32 hospital town hall meetings in the last year and a half. People are wringing their hands. What are we going to do? Well, those are our constituents, and they're going to keep coming back, asking us to revisit this. A lot better option would be to have a do-over, if you will, a mulligan. Start over.
Yeah.
And, rather than taking a meat axe to the entire American healthcare system, we should have pulled out a scalpel and made some adjustments.
I want to talk some more about that and how you can go ahead and have that mulligan, that do-over. We're going to take a short break when Outlook continues with U.S. Senator Mitch McConnell right after this. Outlook continues. I'm Barbara Deeb. We're visiting today with U.S. Senator Mitch McConnell. And before the break, we were talking about, we're going to call you Dr. McConnell now, because you're suggesting that a scalpel might have been a better way to approach the healthcare, the Obamacare.
Yeah, we should have been more modest. I mean, we should have started with the medical maxim, do no harm. Yeah, and to recognize that we already had the best healthcare system in the world, so not that it was problem-free, but a more modest approach, working on the problems of cost, and trying to fix the Medicare and Medicaid we already had, which are driving the country in the ditch. I mean, we now have a debt the size of our economy. The biggest driver of that debt is Medicare. So we should have been more modest. We should have concentrated on the problems we already had and worked on the problems of the uninsured by trying to drive the costs down, which would have brought more people into insurance coverage. We all agree it's better to be insured than not. The question is, at what price? What was the cost-benefit ratio of doing it the way we did it?
To do something like that and with that magnitude takes cooperation. Got to be able to work together and compromise sometimes.
Well, that's a really interesting point. I think I can safely say all of the major social legislation that we passed in this country has been done on a bipartisan basis. Social Security, Medicare, civil rights, welfare reform. Obamacare, totally partisan. Not a single Republican in the House or Senate voted for it. It was jammed through because the president and his party had huge majorities in an entirely partisan way. And so the public didn't accept it. If you look at the poll data, no acceptance by about half of the population. The whole manner in which it was done, in addition to the substance, both how it was done and what was done, is why the American people aren't willing to accept it. And I think it was a huge mistake. They had a chance. I mean, sure, they had huge majorities. They could do whatever they wanted to. But I think you're seeing the price you pay when you do legislation of this magnitude on a one-party basis. So I think both from a process point of view and from a substance point of view, it was a huge mistake for the country.
What are you hearing when you go, now you were at hospitals and holding these town forums, as you call them, but when you're just average Joes, average Kentuckians that you're meeting with, what's the one cry you're hearing from
Well,
them?
in the hospitals, they're worried about their reimbursement being cut because that's one of the ways Obamacare is being paid for.
Sure.
They're also worried about a whole lot of new Medicaid patients coming to their emergency rooms because they will now have a free health care card. 30% of Kentuckians will be getting free health care. And when you say the word free to people, what do? They use it.
They say, yes,
They
free.
use it.
Yes.
So the hospitals are concerned about less reimbursement and more patients and their ability to handle all of that. And that is Obamacare. That's exactly what it does.
Okay, so step outside the healthcare realm. Are they talking about jobs?
I'm glad you brought that up. The Congressional Budget Office, controlled by neither Republicans nor Democrats, says that Obamacare will cost the country 700,000 jobs because it also impacts the private sector. Companies will be making very tough decisions about whether to continue the health insurance packages that they have for their employees, or if they discontinue that, they pay a fine and dump their employees onto these exchanges.
So the fine is probably the lesser
Well, it
of the
depends
two
on the
evils?
company. I think
Right.
every one of these companies, I've met several people today kind of wrestling with trying to figure out what to do in response to it. What we do know is that a lot of companies will not expand employment further because of the cost of adding employees as a result of Obamacare. So it has an adverse impact on the job situation as well. Not to mention, the president promised that this would drive health insurance premiums down. Exactly the opposite is happening. They're going up. Fewer jobs, higher insurance premiums, more debt. What's to like about this? Not much. And that's why you see such resistance to it all across our society.
Well, we can't point at Obamacare as the whole reason for the economy being in the shape that it's in, but let's take a look at the economy. What are average Kentuckians when you're out there and you see them? And they're saying they don't want to necessarily point the finger at Obamacare. They just want a job. They want to be able to feed their families.
Well, I mean, this only made it worse, but it's not the sole reason we're in the shape we're in. This is the most tepid recovery after a deep recession in American history. In other words, in the past, when you had a deep recession, you had a quick and steep bounce back until this one. Look, for 2 years, the president and his supporters could do everything they wanted to. They borrowed, they spent, they took over health care, they nationalized the student loan business, they started issuing excessive regulations against all of the private sector. We had an experiment in the explosion of government before the American people in November of 2010 issued a national restraining order and said, quit doing that. So all of that stuff passed, it's all in place. And so I think we've had an experiment here in the explosion of government. And if that would work, we'd be in the middle of an economic boom.
Yes.
So I think we've pretty well demonstrated that borrowing and spending and over-regulating and threatening to raise taxes is not a great way to stimulate the economy. And even though there may have been a short-term high because the unemployment rate went from 8.1% to 7.8%, if you look at it in terms of the size of the workforce, the size of the workforce is obviously bigger now than it was when the president came to office. But if the workforce were exactly the same size now as it was when the president came to office, unemployment rate would be almost 11%. What that tells you is a whole lot of people just given up. They've just left the job market.
Dissatisfied, or they're not going, they've just given up.
Given up. So, look, there's only one way to get out of this trough, and that's through the private sector. It has to grow and expand and hire people and make products and all the rest. And the government itself has made it really, really hard for the private sector to come out of this recession.
And especially small business.
Yeah.
Because I know you hear from a lot of Kentucky small
Yeah.
business owners who just, they can't get out of the
It's
deep water.
regulation and taxation. You know, this big argument we're having in the campaign over raising taxes on, quote, people, end quote, making over $250,000 a year. I think Governor Romney did a good job explaining who those people are. 1 million of them are small businesses. They don't pay taxes as corporations. They pay taxes as individuals. That represents 53% of small business income and 25% of the American workforce that would be impacted on raising taxes on these, quote, people, these rich people making more than $250,000 a year. Right in the middle of this economy? I mean, this kind of stuff is not going to work. It may be good in the campaign. You know, I've listened to our friends on the other side, you know, try to convince everybody that people who make more than they do, the guy down the street with a bigger house, is somehow getting away with something. You'd be interested to know that the top 20% of taxpayers provide 94% of the revenue for the federal government. 94% of the revenue. Now, the tax code is a mess, but it's not because it lacks progressivity. In other words, the more you make, the more you pay.
Right.
And
but it's in trouble and needs work.
yeah, I mean, you know, the problem here is this is a class envy argument. It doesn't have anything to do with the economy. And then, you know, when you make that point, then they come back and say, well, it has to do with the deficit. You know how much revenue this would raise? Enough to operate the government for 6 days.
6 whole days.
6 whole days. So this is really not about the economy, and it's not about the deficit. It's about the campaign. And I'm sure there are people who believe that somebody's getting away with something, and maybe it's a great way to win a campaign, but it's not a great way to come out of an economic slump.
And in the end, do the people know? Do the people see through that? We're going to talk about that. And then your visit with, I want to say her name correctly.
Aung San Suu
Aung
Kyi.
San Suu Kyi
Yeah.
from Burma. We're going to talk about that and bring her to Kentucky when Outlook continues with U.S. Senator Mitch McConnell right after this. Outlook continues. I'm Barbara Deeb, and we are talking heads on a mission. And our mission today is find out more about what's going on in this country as we welcome and go one-on-one with U.S. Senator Mitch McConnell. Now, we were talking about Obamacare and the need to repeal Obamacare. The Republicans believe that if Mitt Romney becomes president of the United States, that will be job one. You have said as much.
Yeah, and if I'm the majority leader of the Senate, it'll be job one because I'll be setting the agenda instead of Harry Reid.
Well, let's talk about being the majority leader. What are the odds?
50-50. You know.
Such a diplomat.
Well, no, it's a lot of
true.
close
I know.
races. I mean, I could make up an answer, but that's the truth, that we just have a whole lot of close races, much like the presidential race.
Mm-hmm.
I think it's just not clear which direction the American people are going to take, but the day we're taping this, the election's a month from now, and we'll find out.
Well, that's true. And the day that this program will air is the day that the vice presidential debate is taking place in Kentucky at
I'll
Center
be there.
College. And you'll be there, I understand that. You know, statistics indicate and the polls indicate that, you know, vice presidential debates don't necessarily make the presidential campaign. But Ryan's an interesting guy. And Biden and Ryan, what are you anticipating?
Well, I'll say this. I think this debate may take on a little more significance than most of them because of the dramatic significance of the first one. You know, this is one of those rare debates that seems to have actually made a difference.
Why do you say that?
Well, when you have overnight polls indicating by 30 or 40% American people thought Governor Romney won the debate, when you have the president's own campaign manager basically conceding the point, on the day we're taping this, the Pew poll shows, the national Pew poll shows Romney with a 4-point lead. This is one of those debates that actually seemed to have cut through, to have impacted the body politic, and to have restarted, or reset, if you will, the presidential race. So
There's
then
the
you
key.
add the vice presidential debate coming about a week later, and I think it may take on more significance than normally you would be. I was there for the Lieberman-Cheney debate at Center 12 years ago, and it was interesting, but I don't think it moved anything in any direction.
But so that's the reset is the key here, because
Yeah.
even a month out, voters are fickle sometimes.
Oh,
They can
sure.
change their minds.
Yeah.
But you're thinking that this could give it enough momentum to move it in a particular
Well, it
direction?
has moved it in a different direction. The election's not tomorrow, so we don't know what it'll be like on November 6th. But we do know for sure, all the polls indicate that there's been dramatic movement in the presidential contest as a result of the debate. And so our initial discussion was, how does that change the vice presidential thing? I think people will watch it a little more intently. Not as many people. You had over 60 million people watch the presidential. Mm-hmm. I'll bet you 30 or so million in this one. But I think it'll have, because of its proximity
Right.
to a game-changing debate, which we almost never see, I think it'll take on more significance. There'll be a lot more attention paid to it, certainly by the pundits and the political pros and those kinds of people.
And it's in Kentucky.
It is.
That's a nice.
And Center College is a great opportunity for them and for our state, and it gives them an opportunity to remind people that 2 former vice presidents of the United States went to Center, that a former Chief Justice of the United States was a Center graduate. And so it's great for them and also great for our state to have this event again, and I
Recognition.
congratulate them for landing it.
Mitt Romney. Tell me about the Mitt Romney you know.
Well, I think we got to see him unfiltered. I mean, can you imagine anything more pressure-packed than to be running for president of the United States, to go up against an incumbent president, to know that you've got 65 million people watching you on live television, and to have a performance like that? Talk about a guy who can rise to the occasion. And it further underscores what a successful life he's led. I mean, this has been an extraordinarily successful person, both his family, his business, the Olympics, his governorship. This is a man who clearly can handle the job. And the president's no slouch, but he came up against, the other night, somebody who's every bit as equal in intelligence and in talent. And so the American people had a chance to look at the choice. Before this, mainly they've seen the attack ads.
Right.
And, paid advertising can move numbers. And I think a lot of people decided they didn't like Mitt Romney. They didn't know why, but they'd seen it on TV. Here was a situation where there were no attack ads.
Unscripted.
No attack ads.
Yeah.
A discussion with a moderator who, in my view, did a good job by letting it go and not trying to shut people up, letting them talk. I think we saw the real Mitt Romney, and I think there's no question, based on the poll data, that it was a reset.
So 50-50?
50-50 on that one, too.
Okay, all right.
And anybody making a prediction at this point is a fool and just trying to make a headline. I mean, we don't know how it's going to come out, but I think it's a very, very competitive race, just like the control of the Senate.
Aung San Suu Kyi. Did I do a better job?
You did good.
Your lovely wife, who is a former Labor Secretary, Elaine Chao, was in the Bowling Green area recently speaking to the Chamber of Commerce. And it happened to be on the day that she had come from spending the day with you and Aung San Suu Kyi.
Yeah.
And you took her to Lexington. So tell us first a little bit about who she is and why that's significant for the state of Kentucky.
22 years ago, a staff member of mine put on my desk either Time or Newsweek, I forget which, and there was a picture of Aung San Suu Kyi and a story about her and how she won the Nobel Peace Prize in 1991. This is a woman who started off in Burma, who lived abroad, who ultimately married an Englishman, had 2 children in England, and lived abroad for a good bit of time. Her father is widely viewed as the father of Burmese independence, although he was assassinated when she was 2 years old, right after World War II. She happened to go back to Burma in 1988 to visit her ailing mother, and about that time there was an uprising against the military regime that had been running the country since the early 60s. She, because of her name and also her leadership qualities, almost instantly became the leader of the revolution. Now, this was a peaceful revolution. This is not, some of it wasn't peaceful, but for the most part, it was not a
Bloody revolution.
There was some
Right.
bloodshed.
And she was placed under house arrest.
Well, not yet. The regime allowed an election in 1990 and she and her party got 80% of the vote. Can you imagine that? After which the regime canceled the election, put her under house arrest, and she stayed there for most of the time for the next 20 years. So that's how I got interested. And when she was given the Nobel Peace Prize in 1991, obviously she didn't leave the country because she knew they'd have been happy for her to leave, but if she left, she knew she'd never get back in. In fact, her husband
passed away.
Got ill and passed away while she was under house arrest. And she stayed there steady as a rock for all those years. I kept making speeches about it. I'm not taking any credit for this, by the way, but I was somebody who took an interest in it early on. 10 or 12 years ago, passed Burma sanctions legislation, which we renewed on an annual basis, and yet we had never met. And it wasn't possible to pick up the phone and call her. They had a sham election about the time of our election in November of 10, and we thought nothing would ever change. But the new regime freed her from house arrest, began to indicate they wanted to change. In 2011, I talked to her on the telephone several times, and I went there in January of this year and visited her in Rangoon, and while I was there, I invited her to come to Kentucky.
And she wanted to see the horses, so you took her to Lexington.
In addition to coming to the McConnell Center at the University of Louisville a couple of weeks ago, she wanted to visit a horse farm. So my wife and I took her to Lexington on the Sunday before the Monday that she spoke at U of L, and she had a chance to see a horse farm and to pet horses, and it was a wonderful experience. This is, you know, to put her in perspective, she's sort of like Gandhi or Nelson Mandela. And if you're looking for a parallel, closer to Mandela, because Mandela decided not to just be an icon, but to actually be a part of government. She could have stayed on the sidelines and just been an iconic figure and never actually accepted responsibility for anything. But in April of 2012, this year, the regime had a number of elections to the parliament. She ran for election and was elected, and even though she and her party have just a small portion of the parliament, she's now a part of government and has accepted responsibility, and she's evolving, in my view, from Gandhi into Margaret Thatcher.
Oh my, that's a fair jump. And she thought Kentucky was very green, I understand.
Yeah, she loved Kentucky.
She loved Kentucky. We're just about out of time. I'd like to thank you for joining us, as always. We've been chatting with U.S. Senator Mitch McConnell, and that's going to wrap it up for this week's edition of Outlook. I'm Barbara Deeb. We're glad you joined us.